Back with more LEX18 News at 12:30. From shoes to cars, we're constantly comparing the cost, so why not when it comes to your medical care?
Dr. George Privett with Lexington Diagnostic Center and Open MRI is here. Good to see you, sir. How are you?
Yeah, I'm fine, thanks. How are you all? Merry Christmas.
Good. You too.
Yeah, it is something that I think everybody should think about, is maybe to shop around, right?
Well, exactly. What everybody doesn't know but is realizing now is that there's a wide variation in the cost for the very same medical care here in Lexington and around the United States. For example, patients have found out that if they go to for example, a hospital-based facility, an MRI might cost $3,000. Mm-hmm. If they come to an outpatient facility, get the very same test, very same quality, it costs $500. And it's for X-ray, CT scan, ultrasound, MRI, all sorts of outpatient imaging tests.
A lot of people may just be getting referred and think, oh, well, I guess I have to do this. That doesn't necessarily mean you have to go to that particular place.
No, you can definitely be in charge of where you go. You're paying for it, your insurance. And in fact, insurance companies are now calling patients who are scheduled at more expensive places and saying, if you'd like to go to Lexington Diagnostic Center, it's going to cost you only $300 in your copay, but if you go to this other place, it might cost you $1,000. So they're just rescheduling right there on the spot.
You guys cover a full range of diagnostic spectrum. I mean, you mentioned MRI, right?
That's right. CAT scan.
X-ray.
X-ray, DEXA, bone density, and we have nuclear medicine.
Right.
So we do just about everything.
It's important for the patient, as you mentioned, for not only cost-effective reasons, but also to really take charge of their own health care, because ultimately it's their life. They need to be making these decisions. Isn't that right?
Exactly. At least they should know about it and not just accept what they're told. I mean, for example, hospitals are buying up lots of medical practices, and they're encouraging those practices to use the hospital-based imaging. Mm-hmm. So there's an incentive there that's not quite, kosher, I don't think. It's a little financial incentive to use the more expensive places.
Now, if somebody makes an appointment with you, what's generally the wait time, like how long it takes to get in to see you?
Generally 2 to 3 days, sometimes the same day.
Right.
We're open on the weekends and at night, and we've got. And if there's an emergency, we'll take care of that.
We're looking at a price range right now for some of the prices that range out there.
Yeah, through various carriers, as we can see, Anthem, Humana. And so, again, do yourself a favor and always do your research and check.
Call and compare.
Yeah.
If you want to get more information or if you'd like to make an appointment, you can give them a call. The number is 859-278-6724.
Or just log on to LexingtonDiagnostic.com. You get information that way. Dr. Privett, good to see you as always, sir.
Good to see you, too. Thank you so much.
Wet Friday out there, and more.